So I wanted to talk a little bit more about the shoulder pain I mentioned in the previous video. So when I was in the hospital for gallbladder removal, I believe back in 2016, maybe 2017, but I believe 2016. I had started experiencing a lot of shoulder pain throughout the time I was there. I ended up having to have my gallbladder removed originally, and then that did not work out well. There was a leakage that happened, and I was hospitalized for an entire week. Um, and that was a very, very stressful thing, which is one of the reasons that made me weary of trying this bariatric surgery too, is because my last big interaction with surgery was a miserable failure. And even doing so and fixing everything that happened from that, I still have pain in my side, which is basically similar to the gallbladder pain I was having. So it happens. But back to the pain that I was having in my shoulders. So I had noticed that every time, after a while of taking opiates of various types, that it was causing really, really severe shoulder cramping. And it hurt like way more than the actual incisions that I had had from the surgery. So I got to the point where I was just like, okay, let's try and dial it back all the way. Because I dialed it back from, like I said, Dilaudid to morphine, to oxy, to hydrocodone, and it was all just having a negative effect. And it was pretty obvious because, I could have let it completely drain out and it would be fine. And then it would come time for my next dosage. They'd put it in instantaneously, it would happen. So it was definitely the opiates. Um, and that did not happen to me again while I was in there for pancreatitis last year. So I figured maybe it was just a fluke from possibly laying there for so long and, just having a weird adverse reaction since I was there for a week. But this time I found out that's not the case. So it has happened again, and I decided to look it up. And apparently, shoulder pain is something that's actually extremely common with laparoscopic surgeries. So it makes me feel better that it wasn't just me. It's good to know that that's a common thing. It still hurts, it sucks, so watch out for that. It's a possibility. And I would just say if your shoulder pain does get worse than your actual incision pain, then just stop taking your opiates. And, it'll probably honestly help you out too. And I think that's one of the reasons I've been able to have bowel movements so quickly is, I came home, tried to take my medicine one time. It hurt too bad to do it. I haven't done it since. And so now I have nothing that's causing constipation except for possibly the incisions. But everything is working out really well when it comes to that now. So I would suggest, get off your opiates as quickly as possible for so many reasons. Next, I'll talk a little bit about what I've been doing to deal with the pain since then. All right, bye.